Dr. Gera is with us, Director and Head Interventional Cardiology at the Fortis Hospital. We're hearing more reports of sudden cardiac arrest in children. Doctor, is this truly a rising concern, or are we simply reporting it and diagnosing it at the moment? And just like Dr. Bagai was talking about, how soon should routine cardiac arrests actually begin? What are some underlying symptoms, however subtle that they are? What should parents be on the lookout for?
So we can't say that it is a rising trend, because this is cardiac arrest. This is not heart attack. Heart attack is rising, but not cardiac arrest. But cardiac arrest, we need to find out what is the reason actually. So anyone who has a family history of sudden cardiac death, especially sibling, then he needs to be screened by a simple test called electrocardiogram, ECG. Sometimes ECG can tell us that this patient has got some channelopathy or rhythm disorder. He is predisposed to those rhythm disorders like ventricular fibrillation, ventricular tachycardia, what we call exercise-induced rhythm disorders. Any kid who is having sweating when he or she is playing with heavy work, or when there is some history of severe giddiness during exercise or fall during exercise, these are the pointers actually which tells us that there is some problem with the heart. Then an ECG and echocardiogram should be done. Or any when child is born, the child was too blue but he was not screened. So an echocardiogram is must to rule out congenital heart disorders like some holes in the heart, or maybe inversion of some different ventricles, right goes left, left goes right. So there are some congenital disorders. A very important history is high-grade fever. Sometimes high-grade fever, like what used to happen during COVID times, sometimes high-grade fever can involve muscles that can cause cardiomyopathy, even if the child recovers from fever. But in case the heart has taken the toll, then heart function can go down. And if such a kid just gets involved in some heavy activity.
When we're talking about the most common underlying issues, Dr. Gera, hypertrophic cardiomyopathy, arrhythmias, myocarditis. Is there something else that you want to add to the list?
Hypertrophic cardiomyopathy, like channelopathies, like long QT syndrome, short QT syndromes, which can be detected by a simple electrocardiogram. Then there is one term called ARVD, which can be detected by cardiac MRI and ECG. Then there are different like WPTW syndrome. Sometimes they can have such type of rhythm disorders. And congenital heart defects. Sometimes aortopathies can cause dilated heart, and that can cause rhythm disorders and sudden cardiac arrest and fall.